Hi, audience. Thank you for joining us today for this month's episode of the Dr. Fazil Show for November 2021. And the topic of the discussion will be kidney stones.
Thank you, Isabel, and thank you, audience, for having me on this show today. As she said, the topic of the discussion today is kidney stones. As we know, kidney stones, when people have kidney stones, it could be very painful, and most people will end up in emergency room because the pain is so excruciating. So it is better to prevent them. Early detection is better. Prevention is better than cure. So while we're discussing that topic, I think the first question we need to know is what the kidneys really do, because there's a misconception that kidneys just makes urine, and that's not true. Kidneys can do a lot of things. They can do, for example, make they make blood, as well as they control the health of the bones. They control blood pressure, and they also control electrolytes like potassium and sodium in the body, as well as fluid, like how much fluid is going to be in the body. So urine is actually the end product of what the kidneys do. Urine is not just the only thing kidneys do. So having said that, let's go to the next part of her question. That is, what are the kidney stones? So the urine have actually two kind of chemicals in it. One is try to keep the kidney liquid, and one try to make kidney solid. So there's a balance between those two chemicals, and that's why this urine stays liquid in most of the time. But sometimes that chemical imbalance is off, or the balance between those two chemicals are not in the right fashion, and that can cause formation of crystals, and those crystals can get lodged inside the kidney in various locations, like inside the kidney or inside the ureter, which is actually the tube which connects the kidneys to the bladder. And sometimes kidneys, the stones can form by itself, just in the bladder by itself, urinary bladder. And there are various reasons. For example, dehydration, not drinking excess fluid, especially in areas where there's not excessive fluid or there's excessive heat. For example, Arizona and other areas which have environment or topography of environment like Arizona, for example, heated areas with less excessive water and a lot of sweating. We lose water through sweat as well, and that can make urine very concentrated, and that can start the process of crystallization or crystal formation in the kidney, and that can become bigger over a period of time and can cause kidney stone. There are other conditions where it is not due to the lack of fluid, but due to certain chemicals like oxalates or calcium in the blood, which is high enough, which can cause crystal formation in the kidney and kidney stones. There are other conditions. For example, people who have gout, they also have very commonly kidney stones because of the uric acid, which is cause of the gout. So that uric acid crystals get stuck in the kidney and make kidney stones. So there are various causes of kidney stones. And moving forward to the next cause is like bad urinary tract infection, and that can cause stones in the kidney. We call them Staghorn stones. They are like very painful, and the treatment is generally that we have to take the whole kidney off if you have a Staghorn stone. There's some genetic conditions like lack of citrate in the urine genetically, and which is a chemical which keep the urine liquid. So if you're low on that can also make kidney stones. So And there's a wide variety of other conditions which can cause kidney stones, but these are the major causes of kidney stones. We will talk that maybe in another show, but kind of like I said, certain kind of diets, like people who take a lot of chocolates have oxalate in there. Iced tea is cause of kidney stones, lack of excess food intake, dehydration, gout, and certain medication by itself, certain kind of water pills can cause kidney stone as well. And then let me wrap it up. Also, lack of certain chemicals in the blood, for example, citrate in the urine, if that's low, which is a genetic condition, can also cause kidney stones, which is very easily fixable by giving supplements which have potassium citrate, and that can also cause dissolve the kidney stones.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Dr. Fazil, what would be some of the symptoms of kidney stones?
Yeah, so the kidney stones could be asymptomatic, have no symptoms at all, and they might be found incidentally on doing certain kind of tests, for example, sonogram of the abdomen or CAT scan or X-ray, or sometimes they can be painful. If the kidney stones are less than 5 millimeter in size, they can pass through the ureter, which is a tube which connects the kidney to the bladder, and when they pass, they can cause bleeding as well as they can cause pain. So the pain is one of the cause. Uncontrolled high blood pressure, pain in the upper mid back, that is also a symptom of the kidney stone. Blood in the urine, and also if kidney stones are bad enough, it can cause kidney failure by itself, and may need a patient to have to go on dialysis. So it can go from no symptoms to pain or finding blood in the urine to total destruction of the kidney causing dialysis, the whole spectrum.
Dr. Fazil, my next question would be, is it always necessary to get surgery once you detect the kidney stones, or is there an alternative method to this?
Yeah, so again, it depends how bad the kidney stone is. It's a common misconception that you have a kidney stone, you have to have surgery, and sometimes it's true and most of the time it is not. We can easily not only that dissolve the kidney by changing the diet or adding certain medication, but also prevent the kidney stones. So I have seen that patients get kidney stones and then they get referred to a urologist, which is a surgeon of the kidney, and they just remove the kidney and patient go home, and a few months or a few years later they end up having more stones, and it goes on and on and on. So the part which is being missed in this whole treatment methodology is that we need to find the root cause of kidney stones and then fix it. So fixing it not only will prevent the kidney stone, but also will resolve the stones which are already there. For example, what we do once we find out the kidney stone, as a kidney specialist, this is my, besides internal medicine, I'm also a kidney specialist. So what we do is that once we find out there's a kidney stone there, we do certain blood tests and certain urine tests to see the abnormalities in the chemistry of the urine and the blood. Once we find that out, we backtrack to the diet. Most of the cause is due to abnormal diet. For example, people who take too much green vegetables, too much oxalic acid, too much iced tea, too much chocolates. They make a lot of oxalic acid crystals in the urine, and we just have to tell them to stop eating those diet, increase fluid intake, and then kidneys start to get better, and kidney stones get to start to resolve, and eventually patient pass it through the urine. And not only that, but they will not also have kidney stones in the future as well. So that's one way of treating the kidney stone medically. The second way to fix the kidney stone is if you're low in citrate, which is a genetic condition, then we give a prescription medication known as potassium citrate. It's not the potassium what we are after, we are after the citrate. Citrate helps to get enough citrate in the urine, so urine stays in the liquid formation and it does not make stones, and the stones which are already there can be dissolved over a period of time. So I have seen patients have some hormonal disorders like hyperparathyroidism, which is a little tumor in the neck, and it can cause high calcium in the blood, and that can cause kidney stones. So I have seen a lot of those cases which has been misdiagnosed or missed over a period of time, and they not only cause kidney stones but a lot of other complications as well. And what we do is that we diagnose that tumor, which is, I said, generally is in the neck, and once that is diagnosed, we have it removed surgically, and then the chemical of the blood becomes back to normal, and the kidney stones start to dissolve. So what happens is that when the kidney stones start to dissolve, they become small enough and they start to pass. At that time, patient will have pain. So the general question is, okay, doc, we fixed my diet and everything, why am I having pain now? Well, this is something we call it like a phase where the kidneys are so small that they can pass, but when they're passing for good, because there wouldn't be more stone after that. So when they pass, they will cause pain. So we warn them beforehand that you might get pain after we change your treatment or change your diet, because kidney stone will dissolve and they will pass, and then when they pass through the ureter, it causes pain. But afterwards, and on the long haul, they wouldn't get any more stones. So that's how we fix it.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
So, doctor, can you tell me what are some of the complications due to kidney stones?
Yeah, so as I said, it can cause pain, it can cause infection in the blood. The infection from the blood can travel to the kidney, and it can infect the kidney stones, and that can spread to the blood. It could be fatal as well. I mean, it can be very, very bad if those infections are not treated in adequate fashion. It also can cause total destruction of the kidney due to blockage. So kidneys start to balloon out behind the blockage and cause, we call it hydronephrosis. And if it stays long enough, it can cause total destruction of the kidneys. Fortunately, we have 2 kidneys, so if you lose 1 kidney, we can still live on 1 kidney. But if you have both kidneys involved because of the kidney stones, then it will cause patient to have lose total kidney function, and they can end up having to need dialysis, which is not a good situation to have.
Doctor, so what would be the take-home message for the audience about kidney stones?
Yeah, so that's a very good question. So the take-home message is as follows, audience. So certain things you can do at your home which will prevent kidney stones. Number 1, drink a lot of fluid. Again, it depends also on certain other factors. If you have a heart condition or other conditions where your doctor have told you not to drink enough fluid, then obviously you have to follow that advice. But if you have no restriction from other medical conditions, if your heart and kidney function is good, liver is good, then you can drink at least 1.5 liters to 2 liters a day of fluid every day to avoid dehydration. Low protein diet. Animal protein is bad for the kidney stones. Low sodium diet, and then certain kind of diets which are high in oxalic acids. A lot of green vegetables, too many chocolates, iced tea, and there's a whole list of food which are high in oxalic acid. Remember, oxalic acid, that is what causes kidney stone in 80% of the patients. Then if you get a urinary tract infection, get it fixed before it involves your kidneys. And then if you have gout, again, get it under control, because repeated episode of gout not only cause joint pain, but they can also cause kidney stones. And if you got diagnosed with kidney stones, and if you have had surgery done, do see a kidney specialist as well, because if you're a stone former, you will make more stones. And it's no fun to have pain in the middle of night going to the emergency room for kidney stones. So it could be avoided if you once get diagnosed. Then let your primary care doctor have you see the kidney specialist, so they can actually look at the root cause analysis, and so we can prevent the future stone formations. And as I said, a lot of stones we can fix medically. You wouldn't need surgery for every single kidney stones, unless they're like so big that and it's urgent situation, like kidneys are totally plugged up, or you're having bad infection or too much pain, and you don't have time for stones to be fixed medically, because medical treatment takes a little bit longer time than surgical treatment. But the ideal situation is to get fixed medically, because not only it will avoid unnecessary surgery, but also it will prevent more stone formation. So please take kidney stones seriously. They are not just nuisance for causing pain, but they can destroy your kidney function, and that can put you on dialysis. Well, thank you so much for watching this show, audience, today. Drink enough fluid, stay safe, watch your kidney function, talk to your doctor, and God bless.
Thank you so much, Dr. Fazil. It was very informative. Thank you, and stay tuned. We will be back with the next Dr. Fazil episode next month.